Exactly. Assalamu alaikum. Welcome to the program. And we are now joined by Dr. Fatima Bhabha. We started this conversation 2 weeks ago on aesthetics, and she's back with us to talk some more on this booming multi-billion-dollar industry globally. Fatima, assalamu alaikum. Welcome back. Nice to be talking with you once again.
Walaikum salam. Thank you so much for having me on your show again today. It's really nice to see people interested in the aesthetic industry. You know, South Africa was, like I said before, behind the rest of the world, but we've caught up really fast. So that's a good thing. We left our discussion on, neuromuscular injections, which everyone calls Botox, and we discussed that quite. I think today we're going to talk about fillers. So I'm not sure.
But before you get there, Fatima, just let me say you look gorgeous as always, mashallah. And the all-important question, when would you as a medical practitioner advise a patient? I mean, how old is too old and how young is too young to go this route, Botox and other stuff, other interventions?
So I must say, I would suggest putting Botox and filler off a bit later, like, early 30s, sort of late 30s, somewhere there. Before that, there's a lot of other non-surgical procedures that we can perform for people. Having said that, though, some people just have overactive muscles. I mean, irrespective of your age, you've really just got overactive muscles. And in that case, I don't think age makes a difference. It's your muscle strength and how your muscles are, responding on a day. I look at my son every day and I'm like, boy, at 16, I'm going to have to shot some things.
Right.
He's constantly frowning. So it really just depends on where you're at. But personally, I always advise my patients to start. There is a trend around the world that the earlier you start, the better for you. Yes, but in my professional opinion, I would say earlier would be the 30th decade. So in your 30s, not prior to that, unless, of course, it's a bit of a plump in your lip, just for a bit of a pout, a little bit of Botox in the frown, nothing major. Because I'm not sure if you've seen this, but it's trending quite big on social media, is the filler that has migrated. And all these beautiful celebs who looked beautiful before have now got these filler in their faces that have moved. So if they've done it sort of in their cheeks, it's kind of migrated down. In their lips, it's migrated up. So instead of getting the benefit of what was meant to have been achieved, they're actually looking worse than they did initially. So that's also something I want to just, talk to the listeners about, because it's been trending quite a lot in the last 2 weeks. Having said that, is people like that have what we call the overfilled syndrome. So they had initially overfilled their faces. Hence, it migrates and they look worse than they did initially. So like I also said the last time, please choose your practitioner wisely. Look at your practitioner. This is very important. So if you look at your doctor and they look weird or overfilled, I promise you that is what you will look like. Because for them, normal. So if you look at a doctor and they've got big lips and they've got a tight forehead, then that is normal for them. So hence, that will be normal for you because they would do the same thing for you. So have a look at the practitioner. That's very important. Also have a look at the work that they've done. There's a large, idea that, there's a trend. So I'm not sure if you're aware of this, but at the moment, lips are trending, to have your lips.
Goodness me. No, I'm not. I can't see myself with something like that. But anyway, if that's the trend, then so be it.
Lips are trending, and
okay.
Doing a beautiful lip is a beauty. I mean, it looks amazing. So if I would have loved to have showed you a picture, but if you had seen my lips about 5 years ago, they were tiny. So I didn't have much lips, and I had what you called an M-shaped lip. So my lip would go in here, and you would see majority of my teeth.
Ah.
And it just kind of balanced it out so I look, in proportion. Now, as a practitioner, it's very important to give your patient that option, that you don't have to do what the trend is. So at the moment, a trend is a Russian lip. So it's quite a big lip all around. Sometimes it may not suit your patient. And you've got to advise them and say, look, I do understand you want what's trending, but it may not suit you.
Okay.
Or it make you look slightly weird. And this is the thing with aesthetic medicine. It goes through lots of trends. There's always a trend. So for a while, cheeks were trending and everyone wanted to have a cheek. So now lips are trending and everyone wants to have a lip. Last year sometime, it was that sleek jawline that was trending. Everyone wanted to have a sleek jawline. But if my patient insists, then we give them what they ask for. But I have a lot of, a moral compass, for example. We try to make you just a better version of yourself. We don't want to change you in any way. So this is also a misconception that a lot of the listeners need to, know that if you're going to come in or go to any of your practitioners for fillers, they're not going to, we know that they're not going to overfill you unless you ask for it, unless you go, this is what I want. Then it can happen. They would give you that. Then comes the other thing of, am I going to look weird when the filler dissolves? Because remember, filler only lasts about 12 to 18 months.
Okay, so what happens? You've spoken, the key word here is dissolved.
Yes.
What happens where does it go to? Is it eliminated from your system in some form or the other? Or does it go and sit somewhere and create a future problem for you, medically speaking?
So if it's injected correctly in the right space, your body will break it down. That's how it's made. It's not made to last forever. So your body will break it down. So depending on the type of product used, so you get different types. For example, some last longer, some go in a deeper plane. So depending on what you use, that's how long it will last. Maximum is around 12 to 18 months. Maximum. What happens? Your body breaks it down and eliminates via your lymphatic system, like with most. But there are some patients. So there is a side effect of filler migration, where filler moves from where we put it to another area. But it's not a train smash, because remember, we can manually dissolve that and it will go away. So you're not stuck with it for life, if that's a concern. Having said that, though, shukr alhamdulillah, in all these years, 15 years of doing aesthetic medicine,
MashaAllah.
We've maybe had one or two actual migrations. And that was because the patient didn't follow procedure care, or they didn't follow the instructions that were given to them. And then in one case, it is a possibility. It can happen. Now, if you've been doing it for such a long time, like all doctors say, if you didn't have a side effect, you haven't been doing it long enough. It means you've not treated enough patients. So it is. So the thing is, you need to tell. So I tell all my patients all of this before. Look, this is what can happen, even if it's a less than 0.1% chance. They've got to be aware of it. So those are the sort of.
And typically, right, Fatima, typically where would you apply the filler for a man or a woman for that matter? Because really what you're saying is that you want people to look more youthful than they actually are, maybe take 10 years off, their look, so to speak. So it's really, it's making them feel good about themselves. And I'm also thinking then whatever area of work they're in, they are going to perform that much better, because it's about your self-esteem, is it not? You look better, you feel better, and you want to do better at whatever it is that you're doing.
That's right. So if you can imagine what filler actually is like a polyfiller. So if you imagine a crack in the wall and you fill it up with a bit of polyfiller, that's what filler is. So if you have a look, so generally what happens in our youth, we have what we call a triangle face. So if I just lift my face up like this, This is what I would have looked like in my 20s. As you can see, it's a triangle that way. Okay. As we get older, the triangle changes. So it becomes bigger at the bottom and smaller at the top because we get the gravitational pull, pulls us downwards. So what we do with filler, now that's what we call fat migration. So the migration just moves down. That's a normal process. That's what happens in life. What filler does, and as we get older, we lose this youthful plumpness, which we all had in our 20s, 30s. Filler, basically, we use it to just put that youthfulness back, really. So if you had a nice cheek and it's falling downwards, we put it back in your cheek. So we give you that kind of contour. These are the most commonest areas, is your nasolabial.
Okay. Hold that thought. We need to pay the rent. We'll be back with you in a minute or two. We're talking to Dr. Fatima Bhabha about aesthetic medicine. And I think not only the girls, even the guys should be tuned in, because you'll get all of the answers you've always wondered about as far as these procedures are concerned. So stay with us. And inshallah, in the coming weeks, she'll continue talking with us about different forms of aesthetics.
This is the Mid-Morning Talk with Julie Alli.
Kiki's, the taste with a kick. Our revamped exclusive restaurant and takeaway now opened. Kiki's strives to serve you and your family with a wide variety of delicious meals. Enjoy our famous chicken, shish, burgers, pasta, pizza, and many more weekly in-store specials. We offer Friday buffet and bripet with a difference. We cater for corporate functions, valimas, and events. Purja facilities provided. Our exciting competition gourmet menu and new menu to be released at our launch. Visit Kiki's at 235 Matthews Mayue Road, Old Stemford Hill Road, Durban. Call 031-209-0119. Kiki's, the taste with a kick.
They say breakfast is the most important meal of the day, yet many children go to school hungry because of poverty. Penny Appeal's Breakfast Club aim to get a warm, hearty meal to underprivileged children so they can spend the day prospering in their schoolwork. Help feed a needy learner by visiting our website on www.pennyappeal.org.za or call 031 1100 573 to find out how you can donate. Penny Appeal. Small change, big difference.
Freedom Stationery supply Marlin and Marlin Kids pens to me and my school friends. They supply just about everything we need to help us get a better education, from books to files to rulers. In fact, any any accessory we need. Freedom Stationery. Education for the nation. What does accessory mean?
You are listening to the Mid-Morning Talk with Julie Alli.
Aesthetic medicine, and she's going to give us the lowdown on everything you ever needed to know about this field of medicine. Fatima, back to you, and you explaining the issue around where fillers are mainly or mostly used.
So the commonest area is your marionette, your nasolabials, and your marionette lines. So this is what happens as we get older. You know what? Your fat pads sag downwards, and you get this sort of deep groove in these areas. It's very normal. Okay. The thing is with that is when we fill it in, there's a very good technique. I mean, you've got to do it quite nicely, and it fills the area out, giving you your youthful appearance. That was a very common area. Second commonest area is these hollows that we get under our eyes. So if you have a look, it's genetic. It can be, people who sit in front of the computer a lot. Also, with age, you tend to develop this hollow under your eyes and the darkness. So what we call a tear trough filler. That's also another very common one. And currently, like I mentioned before, lips are like the big thing at the moment. Everyone wants to have a Russian lip done. And that's a absolutely perked up sort of, lip. Now, the thing with filler is there's two things you do with filler. You give structural balance. So like I'm saying, as your muscles move and your tendons move, we give structural balance. So as you get older, your bones shift, your muscles shift, we give that structure back. And then we do sculpting on top of that. So it's all a personal preference. I mean, some people want a very contoured cheek, which you can do with filler. Some people, as we get older, another very common area is you get this depression on your temporals. And that's just age. It's not, something weird happening with you or anything like that. It's really just age. As we get older, we get these temporal hollowings, which we fill out in order to give you that, youthful triangle back. So as you've noticed, my take on filler is not extreme. It's more structural, giving back your structure, giving back that sort of 20, 30-year-old youthfulness to your face. I mean, nobody wants to go around looking all saggy and
Right,
sad.
right.
One is a lot of patients come in saying that we look sad, even though, or my children.
Or tired.
Correct. So my children are saying, Mommy, you're always angry, or you're always looking tired. And that's the other one that we use, filler in combination with neuromuscular blockers. So filler and Botox kind of goes together because we use them for what we call neuromodulation. So you kind of teach the muscles to do something different.
Fatima, let me ask you this question. It all sounds very magical, and obviously for people who can afford it, this is a brilliant way of treating themselves, making themselves look and feel better. But let's look at possibly extremes. I don't know if, when I talk side effects, what could go horribly wrong? Now, you've talked about the fillers, you've talked about celebrities, you've given us you've painted a beautiful picture there. But what else can go wrong? Last 2 weeks ago, when you spoke about Botox, you did suggest that the eyes could go droopy if you've over Botox that area. But anything else one should be concerned about? And also in terms of other medical conditions that you might be having. So maybe you suffer from diabetes, maybe you have hypertension, hypotension, and what lupus maybe, or any other,
So that's a very good question. So diabetes, hypertension really doesn't matter. Any kind of autoimmune disease, we tend to err on the side of not treating them unless they're in a stable period. So they can't be having active autoimmune disease at all. So for example, if you're in lupus and you're having an episode, no filler, no Botox for you, basically.
What could go wrong? What could go wrong in a situation like that?
No data to suggest that it can be done. Okay, there isn't any data that says that you can do it in an active phase because obviously you get over-inflammation, you don't get healing of that area, and you can get migration, and you can get what we call granulomas from over-inflammation of the area. Now, I'm going to give you the serious side effects of fillers, and this is very real and it can happen. So what we have is something called vascular occlusion, where you actually inject the filler, not intentionally, into a vessel, so into an artery or a vein. And that, for example, will stop blood supply to a specific area, which can cause that area to actually become necrotic, which is rotten and fall off.
Sure.
So yes, there are some very serious side effects of filler, but having said that, it is reversible. So say, for example, you have someone, for example, I did a bit of filler here, and now the patient is complaining of, there are signs, so excruciating pain not keeping with the treatment done. So you're having excruciating pain, that's a side. You have little pimples that almost look like herpes zoster, like fever blisters on the area. That's another one. And you have, it's like a blanching. So it becomes like a white, if you press the tip of your finger, it becomes like white. The area becomes white. You need to immediately go back to your practitioner, immediately. So what they do is they will immediately dissolve the filler in whatever area they put it. That helps. And they do what we call reoxygenation treatments, where we inject oxygen into those areas to reoxygenate the area. So in the best case scenario, it will get better, and hopefully there will be no damage or permanent scarring. Having said that, though, there are cases all around South Africa, around the world, where people have had severe vascular occlusion from a filler. And that is one of the most severe side effects that you can have. Hence, you need to be adequately trained. You should be, qualified. You should, as I'm saying, as a practitioner now, you need to keep up with your learning all the time. You need to know your anatomy, like the back of your head, where the vessels are going, what they're doing. Having said that, though, there's a meme on social media. I'm not sure if you've seen it, but a patient will ask, will I bleed? And your entire face is covered with vessels. And that's ideally the truth. We can know everything, but like we know, Allah knows best. So, I could say, okay, anterior nasal artery going down here, I'm going to inject here. And Allah forbid, he's now done something different in that patient and it's, slightly to the left. So you have to be very careful. And also the first 24 hours after filler are critical. So we always tell our patients, you shouldn't be getting on a flight going somewhere. You should be in the vicinity of your doctor. So if something happens, you can come back, very quickly. So those are the major side effects. There's one more thing that I didn't tell you about filler though. We have what we call, it's a filler that's not like polyfiller. It's actually a filler that we use for elastin and collagen stimulation. So if you have a look, the first signs of aging is usually our neck and our hands. So what we do is we use this filler to actually rejuvenate the skin, to just add hydration back into the skin. So you don't get any change or any structural, change, but you get a change in the skin and the quality of the skin. So that's also another thing that we use filler for. So that's kind of the entry level filler, which is more hydration more than actual filling. So the name kind of says what it does. It fills the area that you're injecting it into, basically.
Okay, we almost at the end of the show this morning. My final question to you, and I hope that we're going to be seeing you again next week at the same time, inshallah. What about someone who's had very bad acne, and I think I brought the subject up last week, I'm not sure if you remember, lots of scarring on the skin, and the skin's even gone off color, but this is a male. What can you do? Oh, and the person smokes as well, which I know they say smoking ages you, up to 10 years. What can you do for a patient like this? Would you first suggest that they go to a dermatologist to clear up the acne and then start working on them? Or can you immediately start working and showing results?
We always clear the acne first. That's first. You need to be not in active acne. You can't be having pimples and scars because you can't treat the scarring and the pimples. Remember, it's two different processes. Scarring is diminishing of elastin and collagen, and pimples is inflammation of the actual area. So we need to get rid of the inflammation first. There's a lot of good things that we can do for acne and acne scarring. Now, in the olden days, we used to use filler. We used to actually fill the individual scars with filler, but we've moved on from that. We've moved on years past that. What we do is it's a bimodal treatment plan. So we treat the skin. So we would do something like peels or lasers, things like that. Then we treat the deeper layers of the skin. So we use the type of filler I just explained to you now that gives you skin rejuvenation. We actually inject that into the between the scar and the muscle, so that we lift the scar up. And the best thing for acne scarring currently is really laser rejuvenation of the skin, because what you do is you can individually target each scar. You can do a full area around it. You need to stimulate elastin and collagen, basically. They also need to be on a good skincare regimen, because remember, you see your practitioner once a month, maybe twice a month. What you put on your skin is every single day. That's going to help us give you a good result. So those are the three kind of things that we do. Having said that, acne scarring is one of the hardest things to treat. It's a long-term process. You need to find someone you're comfortable with, because you and that person are going to have a good long-term relationship.
Absolutely. Okay, what are we going to talk about next week? I'm thinking, and I know I raised something with you off air a while ago about surgical procedures, and you said there are better and alternative methods. Surgical is very, very invasive. So do you want to
moving away from surgical procedures. People want to do more non-invasive, more things, less downtime, sort of quicker results. So what we can touch on next week is all the different type of chemical peelings, why you need to peel your skin, what kind of chemical peels you need, what indications, what you should be looking for in a chemical peel, what is the difference between a chemical peel and a facial. They're not the same thing. And from there, there's a lot of questions: hyperpigmentation, acne, that glow that people want to have all the time, just uneven skin tone. There's a wide variety of topics that we can cover in the chemical peel spectrum.
Okay, brilliant. I'll be in touch with you. Stay beautiful, alhamdulillah, and we'll talk again. Jazakallah for your time.
Assalamu alaikum.
Alaikum salam. That was Dr. Fatima Bhabha. She's an aesthetic medical practitioner. She has a practice in Bedford View and one in Rosebank, Johannesburg. She has two sisters who are medical doctors as well, and they all three are in the practice, which is called Beauty and Curves. And those are the type of people you want to put your beauty. You want to put your life and your beauty into their hands, because she certainly knows what she's talking about. More of Dr. Fatima Bhabha and the treatments that she offers on the show next week at the same time, 11:33, and we are taking an ad break before we joined by Lydia Rue about, a whole host of things: self-mastery, leadership, ownership, mentorship, and many more ships. So stay with us.